Happy National Lyme Awareness Month. This is day 2. I think it's day 2. I'm pretty sure. I know this is the second video that I've made. If it goes up today, yay. If not, day 3. Today I want to talk about how Lyme disease is called the Great Imitator because it imitates a lot of other diseases, which can cause confusion and problems when trying to get diagnosed because you show symptoms of other diseases, and so doctors are more likely to misdiagnose you because you have these other symptoms. A few diseases that Lyme disease is likely to imitate: fibromyalgia, lupus, MS, chronic fatigue syndrome, Bell's palsy, ADD. All of those have very common symptoms that Lyme disease has that a lot of people share, and so doctors are likely to misdiagnose you with one of these diseases. Some people also have more than one of these diseases. They have fibromyalgia and Lyme, or they have ADD and Lyme, and sometimes they just go hand in hand. But since Lyme disease is known as the Great Imitator and it has so many different symptoms that some people have, some people don't, I thought that I would share what it's like for me to have Lyme disease. Now, at my absolute worst, I've said this a million times, my absolute worst, I was completely bedridden. I could not even sit up in bed for more than like 5 minutes at a time. And what I mean by that is that if I did try to sit up, I would just be so overcome with like dizziness and weakness and just feeling very generally just sick, just like exhausted and sick, like I had been sick with a fever, for a week. That's how sick I felt. I was also having seizures a couple times a day. For me, seizures, I was completely conscious, but my body would just suddenly go into like convulsions, like I couldn't control the movements of my body. The whole room would be spinning around me, and all I could do was just lie there and wait for it to pass. And my body would like shake, and it was really, really scary. I hated stuff like that. I mean, obviously, who wouldn't? And I was having those a few times a day, and that went on for weeks. And that was like really right at my very, very worst, just before diagnosis, just before my antibiotic treatment started. Ugh, it was bad. Other symptoms, I was dealing with joint pain, joint swelling, mostly in like my knees and my ankles, wrists, and fingers. A lot of people with Lyme disease will have like stiffness and pain in the neck and shoulders. I never really had that, but that's something that's very common with Lyme patients, is just a lot of pain and stiffness in the neck and shoulders, like you feel like you can't even move. And it's my understanding that that's similar with fibromyalgia. Again, I'm not too sure about fibromyalgia just because I don't have it. Though I know that it deals a lot with pain, general, like all over pain, which is common with Lyme as well. And see, that's the thing with Lyme, is that your symptoms can change and evolve and move, and like once you do start treatment and some things start to get better, it's like other things start to come up. It's like you're an onion, and once you start treatment, it's like those layers start to get peeled back, but there's like still so much inside that still needs to be repaired and healed and restored and all those words. So you have to keep treating everything that continues to come up, because with the Lyme bacteria spirochete, that it's like in your blood, if the disease has progressed to chronic, like if you've had it for years, then there's a chance that this spirochete isn't even in your blood anymore, that it's already gone to your brain or to your muscle tissues or wherever it is that it found weakest. And once that happens, it's really, really hard for any type of medicine to, get in there and start healing and killing off the spirochete and everything. With all that being said, Lyme disease is extremely hard to treat, and there isn't one definite treatment. Something that worked for me isn't necessarily going to work for someone else. Something that worked for someone else isn't necessarily going to work for me. And that's just how it is with everyone. And that's why it's so hard to treat, and that's why it takes years, because you go through so many different types of treatments, you go through so many different types of medications and supplements and just different therapies, and until you find that exact regimen that you need and you stick with it, it's just, there are moments when it just feels impossible. Thankfully for me, I found something that has worked, has gotten me, headed in the right direction. I'm still working towards it, but I'm a lot better today than I was when I first made this channel, 4 Mays ago, 4 National Lyme Awareness Months ago, which would be 4 years. 4 years ago. So I've been in treatment for 4.5 years now, and I've seen improvement, but it took a long time, and it took a lot of hard work. And by hard work, I don't mean like I was exercising or anything like that. I mean hard work emotionally and mentally to, keep myself going. And like, you feel exhausted and you feel like giving up and you just feel like you can't do it anymore, but you wake up the next day and you're like, well, I've made it another day. I'm just gonna keep doing what I'm doing. I'm gonna keep going to my doctors. I'm gonna keep trying different medications. I'm gonna keep getting my IV therapies. That's what I did. Anyway, the Great Imitator, Lyme disease, is because it comes with so many different symptoms that are different from person to person. It really is a very hard disease to diagnose and treat, which is why we need more awareness, which is why this month is important, to bring light to this disease so that, doctors are more aware of just what exactly it is that's making people sick. That's it for this video. I hope you guys are having a great week, a great month. Don't forget to paint May lime green, and I will see you guys in my next video. Bye!